everybody, I'm Marla with 9 Health, and this is our weekly Facebook Live show called Health Happens. Today I'm very privileged to be joined by Lindy Hinman. And Lindy, you're the Director of Medicare here in Colorado for Cigna.
That's right, yeah, I'm the market president. I just recently joined this market to help launch our product.
That's great. Welcome, welcome, welcome.
Thank you.
We are in front of fire today. This is a fireside chat of sorts because we're
Very regal.
Yes. Talking about something very, very important, though.
Yes.
Health insurance is one of the best things we can do for our health, but it might not be the thing that we want to talk about all the time. And so what more comfortable place could we be in front of a fireplace? Let's dig in. Let's learn a little bit today about Medicare Advantage and in this comfortable setting. How about that?
That sounds great.
So first, can you just maybe tell us what is Medicare Advantage and why we should be caring about it right now at this particular time in the year?
Yeah, that's a great question. So Medicare Advantage are plans that are offered to seniors that are facilitated through a private insurance company. And so they're an alternative to traditional Medicare.
Okay.
And they cover all of the basic things you'd expect in Medicare. So Part A, Part B, and then in some cases Part D, which is prescription drug coverage.
Okay, so one-stop shopping.
That's right, one-stop shopping.
Very good, very good. And I am hoping to be 65 so that I can take advantage of these plans one day. Yes, that's when I can do
That's right,
it.
and don't worry, I will be right there to help you.
So that's the next question. When can I enroll in a Medicare Advantage plan?
Great, so there are really 4 opportunities to enroll in a year, and 2 of the opportunities are really driven by time, and then 2 of the opportunities are really driven by events.
Okay.
So, and it'll be specific to your individual circumstance. So the first one, and it's important because this is right now, is called Annual Enrollment Period, or AEP, and that goes on from October 15th through December 7th of this year.
Oh, that's coming up.
Yes, so we're getting towards the end of AEP right now.
Okay.
That's important because if you are interested in purchasing a Medicare Advantage plan for the first time, or you're looking to switch your coverage, this is the time to do it.
Okay.
When you make that decision, when you're ready to access your benefits through a Medicare Advantage plan, those benefits will be available to you on January 1st of 2020.
Okay.
Right.
So you have to decide by December 7th, and then they'll be available to you January 1st.
That's right.
Got it.
Then, just to make things more fun, January 1 through March 31st of this coming year in 2020 is called Open Enrollment Period. And that is a time where if you've already selected a health plan, but you're interested in making a change, you can make up to 1 change during that time.
Okay.
So for instance, if you've made a decision that you think you may not be the best plan for you, you have an opportunity to make a switch during that time.
Okay, so this is a lot of information, and
Yes.
really good, important information, and timely.
Yes.
We will have this on our website as well, 9healthfair.org, Cigna.com, so that you don't have to remember all these dates, because I know I wouldn't. So what else do we need to know about the timing?
Great. So those are really the time-driven open enrollment periods. And then you have 2 that are more life event driven. And so the first is when you turn 65. So not everyone is 65 currently, right? And so when you do turn 65, no matter what time of the year that is, you have 3 months before that birthday and then 3 months after that birthday to make a decision about choosing a Medicare Advantage plan or traditional Medicare.
Okay.
So that's a time where you can also enroll. And then the last one is if you have a major life event. So let's say a great example would be if you move. You might move to a location where that health plan no longer applies, and then you would have the opportunity to enroll in a different plan.
Okay, so if on my birthday, 65, or if there's some other life event happens, I can.
That's right.
Okay.
And that's called a special enrollment period.
Special enrollment
Right,
period.
and those are really life event driven. And if there is a big life event, you should always check in and make sure that your insurance coverage is still applicable based on that life event.
Yeah, that's so important. Okay, so there's really a lot of choices about Medicare and Medicare Advantage plans, and I know Cigna is offering a Medicare Advantage plan for one of the first times, right? And so
That's right.
Tell us a little bit about that. What does that include?
Yeah. So we're really excited to be offering Medicare Advantage in Colorado. And the reason that I'm personally really excited about this is that these products are really great for seniors. And there's really a couple of things that are embedded in that comment. First, they're often very affordable.
That's important.
So that can be very important. And then, you also potentially get access to additional benefits. So you might get access to things like hearing, vision, transportation, acupuncture.
Oh, wow.
So there's these added benefits that can be made available to you through a Medicare Advantage plan. And that's really, I think, a wonderful part of what you're buying when you buy a Medicare Advantage plan.
Yeah, it's a big advantage.
Yes, exactly.
Hence the name.
We always encourage people to shop and really get advice when you're making a decision. This is a very, very important decision for you and your family. And you really want to be looking at things like your out-of-pocket costs, your premium, your deductible, your copay, your co-insurance.
Right.
Whether you have pharmacy coverage, that's another really important thing to look at. And then, of course, is my doctor, my hospital, my pharmacy in my network, who's really offering me the services once I sign up for this coverage? So making sure that you've got a really nice set of benefits and services that you feel good about when you enroll.
Yeah, important points to remember and things to look for whenever you're choosing a plan. So I think sometimes we maybe don't look at all of those things. So really great reminder. What kind of Medicare Advantage products does Cigna particularly provide?
Great. So first I just wanted to talk a little bit about Cigna and our decision to come into Colorado.
Yeah, please.
So I think, we are a leading healthcare company nationally. And in fact, we have about 1.2 million customers across the country. And 4 out of 5 of those customers would recommend us to a family or friend. So we believe we are a wonderful resource to the people that we serve. In addition, that's the national perspective. We've also had a very long-standing relationship in Colorado. And in fact, we've been in Colorado for over 20 years, and we've been offering products in both the employer market and then also the individual market.
Okay.
And so as we looked at Medicare Advantage, we really were excited about leveraging that strength of relationship in Colorado specifically to bring seniors the Medicare Advantage product as well. And we're really focused on improving the health, the welfare, the peace of mind of our customers, and we really want to extend that to the senior population.
And one of the things I think when we talk about insurance, sometimes we just want to go to sleep and not worry about it, but it's so important. It's one of the best things we can do for health. And we hope that people will pay attention to these things and really choose the plan that's right for them and consider all the things that you have to offer. And you're right, when we think about it, turning 65 might be really a great thing to do because you get all these advantages. So
that's right.
Yeah.
That's right. And I really do think it's a fabulous program, and I really encourage all seniors to look at Medicare Advantage closely in terms of what they're selecting in the market. And there's lots of opportunities to talk to different people about your choices and making sure that it's the right choice for you.
Right. And that's important too. We'll have resources on 9healthfair.org, Cigna.com, so that you can check out and really compare and contrast, do your research. It is getting warm here in front of the fire. Is there anything else that we need to let people know? How would they even get to find out about the Cigna plans?
Great. Well, a couple things I just wanted to add in terms of the actual benefit itself with Cigna, and I'll just hit a couple of the highlights, and then of course you can show the details on the program. But we will offer a zero. So first, to clarify, we have both HMO and PPO products, and this is in Denver and Boulder in 2020. So just to be clear about our geographic coverage.
Got it. So Denver, Boulder.
Denver, Boulder. And we have some great products. So zero premium products, zero prescription drug deductible. We have $0 copay if you visit a primary care physician.
Yeah,
so
that's great.
There's a lot of wonderful benefits in there, and we're really excited to have people look at this product. In terms of accessing information about Cigna specifically, you can call our 1-800 number. It's 1-877-534-0198. And if you call there will be a licensed representative to help you with your coverage. And then you can also just go to cignamedicare.com and get more information there if you're not ready to talk to somebody.
We'll put that on the screen too, so people, you don't have to remember it all.
And obviously I couldn't memorize it, so I had to look at
That's
it.
right. Hey.
But do call, get some information, and just make sure that you're making a good decision for you and your family, and you're getting somebody to help you with your decision if you need it.
I think that's so smart. Thank you so much for this advice.
Thanks,
we
Marla.
talked about insurance and Medicare Advantage plans today in front of the fire.
Yes,
and
it's getting warm.
We're now warm, and so we're going to sign off here, but we will see you next time. Thank you so much, Lindy Hinman.
Thank you, Marla.